Happy Nurses Week to my amazing colleagues, and thank you for being here this afternoon. I am in downtown Phoenix, where I'm presenting to you today. A little bit about myself, and I want to just preface my introduction with Craig. At any time during the QA, if there are any messages, questions that pop up, please feel free to pause at any time and stop me so we can answer those questions. So as Craig shared, I am the Dean of the College of Nursing for all 48 states with the University of Phoenix. And I have had the pleasure of joining our workforce team. A little bit about my background. I've been a registered nurse for over 25 years. 17 of those years were spent in critical care, trauma, and the intensive care unit, primarily in downtown San Diego in a level 1 trauma unit. My PhD, I completed it in 2018 with the University of San Diego, and my focus is on long-term weight loss outcomes in the bariatric surgery community. So with that said, I have the distinct pleasure of sharing with you a little bit about the history of nursing today in honor of our Nurses Week and our amazing profession, as well as look at our core values in nursing and recognize the pathways into nursing. I'm going to advance my slide and just recap that we are going to preview the evolution of nursing care from primitive to present, look at core values, and recognize pathways. So what we're seeing here is the evolution. And just to recap, in the past, there were a lot of very, very archaic and very primitive ways we viewed healthcare. And many of the first physicians were witch doctors who treated illness with ceremonies. Herbs and plants were used as medicine. And one of the first surgeries, believe it or not, was to cut a hole into a patient's skull to release the demons anytime they had a mental health illness. So we've come quite a long way. The Egyptians in 3000 BC were the first to keep accurate health records and wrote prescriptions on papyrus paper. We had physicians who were also priests, and temples were places of worship and places for healthcare, medical schools and hospitals. And with the understanding of anatomy and disease, embalming also took place. We used to discover that our Egyptian heritage had gauze to wrap the bodies, much like surgical gauze we use today, as well as strong antiseptics were used during embalming, which leads now to our current day antibiotics. Leeches would be used for bloodletting, which has led now to our blood drawing. And saliva, we also discovered of these leeches had anesthetic properties, which has led now to our current anesthesia that we provide. So a little bit more history. You can take a walk with me down the history of nursing. We've got dark ages from 400 AD to 800 AD, where the study of medicine was actually prohibited and emphasis was more on the spiritual saving of souls. Monks and priests were treating patients with prayer. And as we approach the Middle Ages, the bubonic plague killed 75% of the population in Europe and Asia, and hence the introduction of medical universities. The Greeks and Romans were the first to head the pathway for medical education. And then in the Renaissance era, 1350 AD to 1650 AD, the dissection of the human body led to greater understanding of anatomy and physiology. And of course, fast forward to our future, we've got the medication aspect in the 16th, 17th, and 18th centuries, as well as the development of our first vaccine in 1796 to cure the spread, to prevent the spread of smallpox. And of course, our hero, Florence Nightingale in the 19th century, was a pioneer individual who led infection control methods, of course, with washing of the hands first and foremost. In the 20th century, we discovered blood groups, and new medicines were also developed, such as insulin to treat diabetes, antibiotics to fight infection, and vaccines. We also discovered in the 20th century machinery that helped to sustain failing organs, such as dialysis machines. And of course, for heart transplant or any kind of cardiothoracic surgery, the heart-lung machine, and also the diagnostic test of the CT scanner. Surgical diagnostic techniques became more refined. We started seeing organ transplantations, limbs being attached, test tube fertilization, and the first implanted artificial heart. Here we are, present day, 20th century. And what we're seeing is, as a profession, nursing, we are really trying to catch up with all the systems that surround healthcare, right? So we've got healthcare plans, Medicare, Medicaid. We also have the aspect of rapid advancements in technology, such as, all the wonderful life-saving techniques that we have going on, as well as research that go along with those interventions. And policy, much like nursing, the politicians and the policymakers are trying to catch up with all the societal issues, such as the social determinants of health. So we are within a rapidly transforming and evolving societal environmental environment. Let's just bring it down to what really matters in nursing. As far as core values, what's at the heart of nursing? At the University of Phoenix in the College of Nursing, we recognize these core values that we teach every single student throughout their program with us or certificate with us through the University of Phoenix and the College of Nursing. Leadership, scholarship, professional practice, interprofessional collaboration, safe, patient-centered care, caring, and then diversity, equity, and inclusion. Now we're going to dive into the various pathways. So this slide is a little busy, but at the very top in dark red, you'll see that across the columns, we've got the LPN as an entryway into nursing practice. It is not a degree, and it's much more skills focused. So phlebotomy, for example, some states IV therapy is allowed in the scope of practice for LVNs, and certainly medication administration. In the next column, we actually have the beginning of the nursing degree and entry level into practice, and allows the nurse or the graduate to sit for the NCLEX, the National Licensure State Board Examination. So an associate's degree provides not only the ability for a candidate to sit for the RN license, and there you can see my name. I am an associate degree graduate nurse. That was my first entry level practice. And just as FYI, I served as a CNA, a certified nursing assistant, for 6 years in a skilled nursing facility prior to becoming, as I put myself through school and achieving my associate's degree. So that is the entryway into the first degree. A bachelor's degree is the preferred by the industry, meaning our major hospitals, especially if they are magnet status. Magnet status is a distinction that hospitals aspire for. It means that you are the cream of the crop as far as your nursing care. And with that magnet status, we're seeing a call for more baccalaureate level nurses in those hospitals. So this is the industry preferred degree. And as you can see, my name there would be, once I achieve that degree, would be BSN RN. And on to the master's graduate level. And this is where a lot of wonderful diversity and focus can happen in the nursing profession. So we've got at the University of Phoenix several different pathways, and I can share that with you in a little bit. But it really allows a nurse to become more focused and concentrated. So as I shared, I served as a trauma and critical care registered nurse at UCSD Hospital for about 8 years and it was actually actually during the time when COVID or SARS was an epidemic and not yet a pandemic. And this was in the early 2000s. And the treatment, believe it or not, is still the same to this day. So back then we were intubating the patients, of course, during respiratory failure. We were inversing their inspiration expiration ratio. We were using nitrous oxide at the bedside. We were doing a lot of proning, repositioning of the patients. We had angel beds where we would flip the patients over. But the focus is to let you know that in the master's degree, you can certainly have a concentration. As you can see, I was a certified critical care nurse. And there are different pathways in the master's degree program. There are nurse practitioners and various concentration even in the nurse practitioner level. And of course, the non-advanced practice, which would be, for example, a master's in nursing education as an example. And finally, we are really recognizing the doctorate in nursing practice, much like our colleagues in pharmacology, the PharmD, and of course in medicine, the MD. And of course, for example, the physical therapy, the DPT, doctorate in physical therapy. We now have our wonderful practice doctorate, which is now affectionately titled and named DNP, a doctoral in nursing practice. My degree is a PhD, and that is the difference, in case you're curious to know, between the PhD and the DNP is that the PhD does a lot of philosophizing, and that's what PH stands for, philosophy. Philosophy doctorate. So we take many various theories and philosophize and create a hypothesis and then do research. Now, once that hypothesis and that research is performed, it is now becoming evidence-based practice. The DNP takes that evidence and research and applies it at the bedside. So there's a distinction between the two degrees. However, the DNP is just as valued and recognized as the PhD. So going back to that first column, the vocational nurse, LPN or LVN, in some states they're called. The pathway for that could be a student could be an EMT, an emergency medical technician, or a medical assistant, or have a phlebotomy certificate, or like me has had a certified nursing assistant certificate. The requirement for most vocational nursing programs is a high school education and a certificate, or a certificate GED. Forgive me if I know this is here. For the associate's degree, it does require a little bit more prerequisite work. Prerequisite meaning you've got a lot of math, statistics sometimes, English, of course, because we have to be able to convey patient care as well as write it and transcribe our nurses' notes. Your sciences, this is anatomy, physiology, microbiology, chemistry, are often prerequisites to the associate degree program. Communication, and of course your social sciences, anthropology, psychology. Most programs also require the TEAS test, which is a national recognized test provided by ATI, Assessment Technology Institute. And it is much like the MCAT or the LSAT, MCAT for medical school or the LSAT for law school. So the TEAS test does consist of math, English, science, as well as reading comprehension. And moving into the bachelor's degree, that degree, again, is employee preferred, especially if they are magnet hospitals. You can enter the bachelor's degree as an RN already, much like the program we have at the University of Phoenix, where you're pursuing RN to BSN, or you can have go into a straight traditional program where you don't have the RN yet and you're just looking to seek your 4-year degree at the end of your program. At the University of Phoenix, we do have 2 different BSN options, an RN to BN traditional program, which courses are 8 weeks in length and they're taken 1 day at a time. Really quick, it takes approximately 14 months, 12 to 14 months, depending on the student. And with we have something called another program called the CBE program, which is competency-based education. It's slightly shorter than the traditional program. It allows a student to take up to 4 courses in one block over a traditional 16-week semester. So the framework for the CBE program is a little bit quicker paced, and the student is self-paced and self-governed. You have 2 professors there guiding you through the courses. But it is incumbent upon the student to get the work done within that 16-week time frame. And again, the student might be taking up to 4 courses at one time. Are there any questions? I'll pause there, Craig. Do we have any questions in the chat?
Not to this point, but if anybody has any questions, please put them in the Q&A, and I'll make sure Dr. Brooks gets them.
Absolutely. Thanks, Craig. Moving on to the master's degree. I did share that this is where we get really creative in nursing, and you tend to see a lot of different focuses. At the University of Phoenix, we offer the master's in administration, the master's in nursing informatics, master's in nursing education, and as well as the family nurse practitioner program, which is also a master's degree. My master's degree was actually in nursing education. My mother was a 3rd grade teacher, fun fact, and teaching does run in my family. My brother is a 7th grade algebra teacher. My sister's a lawyer, so she's kind of the oddball. So with that master's degree, you can really focus in on your work. And so it all depends on what you'd like to focus your career on. And what's the beauty of these master's degrees is that you can certainly be qualified to move into your terminal degree, no matter what your focus is, and no matter which terminal degree you choose. So with a master's in nursing education, I chose to go to the University of San Diego for my PhD program. So again, you don't have to be a certain type of master's nurse in order to progress into your terminal degree, whether it be the DNP or the PhD. And I'm really happy to share with the doctoral degree, the College of Nursing at the University of Phoenix does have a DNP program. We started it in 2021 and have had some excellent success and outcomes. Recently had a CCNE accreditation visit, which is the College of Collegiate Education and Nursing, Commission and College of Education of Nursing, nursing education, which is extremely an important accreditation visit for us. And we anticipate some excellent outcomes, and we would like to be able to share later this year that we are fully accredited. At this time, I'm not able to state that until we get that letter, but preliminary visit reports share that the program is stellar. It's got excellent outcomes, and we've got a wonderful group of first cohort students graduating. So depending on your interest in your master's, you can certainly, it doesn't really require a specific focus. As long as you have a master's degree in nursing, you would be able to apply to the program. The beauty of being a career-focused university, the University of Phoenix has been doing career education and guidance for the past 40 years. And for example, when COVID hit, in our educational space, it was no biggie because we do it well. We do it really well in the virtual space and online education. So our programs in the College of Nursing specifically do focus in on real life career type of education. Our projects, our assignments focus in on real world scenarios that the nurse would be able to apply in their workspace. I'll give you an example of one of our courses in our BSN program. In our community health course, we have something called emergency preparedness, where we have a council that attended a meeting, and on the council for the College of Nursing, we have leaders at the American Red Cross. Actually, the head chief nurse officer for the American Red Cross sits on our advisory board, as well as many other healthcare leaders. And they shared, Dr. Brooks, we really could use a focus on how to prepare the nurse for emergencies. With that said, the assignment in the community health course consists of the student creating their own shelter, emergency shelter, identifying all of the key personnel in the shelter. We asked the student to locate a shelter, what would be the parameters of the shelter, running water, electricity, the actual in and out exits for the shelter and pathway to the shelter, or directions to the shelter, and ancillary people to support the shelter, supplies, your budget. So it really prepares the nurse to be a leader. And how would you mitigate and triage patients who possibly have coming into the shelter with illnesses? So that is an example of real life scenarios as far as assignments within the nursing programs at the University of Phoenix. We have our professors, our subject matters experts. They are serving and working in the spaces that they in the courses that they teach in those content areas. And we really try our best to keep the traditional feel of nursing as far as our core values that I mentioned earlier, but very innovative in the way we frame our content and with the way we provide our assignments for students. So it makes it real, and you feel it, you see it, you taste it, you live it, even in your place of work.
Hey, Ray, there's a question in the Q&A I'd like to read to
Sure,
you if you can pause
please.
for a second.
Absolutely.
Okay. I'll put my video on so you're not hearing from Darth Vader. So a question was asked, what types of new certificates or degree programs do you think will be popular in 5 years?
Oh, that's such a great question. I love that. Thanks for asking. Well, I do believe with our national healthcare reports out there, mental health is a big issue in the United States, and we do have a call to action as in nursing education to support the mental health community and the needs of our community, mental health needs of our community. With that said, we are in the process of finalizing a program for the nurse practitioner, psychiatric mental health nurse practitioner. I also see that there is a huge call for education in community health with specific focus on providing healthcare to the term vulnerable population is not favored, but diverse populations is. So if you're familiar with the term vulnerable, it means it's an underserved population of patients who may not necessarily have the resources they need in the community. So community health is going to be an extremely important focus in nursing education over the next 5 years, as well as mental health. I do also see that virtual telehealth is a big focus as we start to see a lot of healthcare entities pivot to that virtual assessment of the patient and virtual treatment. Nursing also has to learn how to pivot and serve in those areas. So great question. I hope I answered your question.
I think you did great. There's actually another question. So
Sure.
while you're on a roll, and I know you're an expert in this subject matter, so let me read it.
Sure.
Do you believe that burnout in the nursing field is the highest it has ever been? If so, do you think learning and development can help to alleviate that burnout?
That is such a great question. Absolutely. We've done some research and at the university and really looked at our students and made some great pivots as far as our currently enrolled students. Just I'm going to give you. My husband always says, "Quit building the clock and just tell me the time." But I'm going to kind of build the clock for you with that question. We've done some research and we're seeing that a lot of our students are pausing their programs because they are making a lot of money out there, working 5 days in a row so that they can, get that financial stability for their families, and we appreciate and respect that. So we've had to pivot to allow students to come in and out of the program so that they can, at the end of the day, complete their program. With that said, we also see a trend where nurses who are serving at the bedside are getting very burned out because of that opportunity of being able to work up to 7 days a week, right? Because there is not enough supply, right? Not enough a supply of nurses. There was already a shortage to begin with, and what we're seeing is with COVID, we are starting to see a little stabilization as far as the workforce, but there's still a supply demand for nurses. And with that said, a lot of employers we're also seeing are trying to figure out how to retain their nurses. And they also partner up with educational institutions such as ours to say, okay, we want to retain our nurses. We want to develop the talent. We want to keep them in our workforce, and we want to show our support. So let's help them to go back to school. It's scary. It's scary to go back to school to make that decision. It's a big obligation and big commitment. But what we're finding is, because by virtue of going back to school, you're exposed to many other of the classmates within your cohort. You're certainly exposed to the guidance of your professors, who provide wonderful, not only educational support, but psychosocial support for the students as well. And just being there and listening. And we pride ourselves in making sure that whatever caring aspect our professors had during their practice days at the bedside, that caring aspect is also translated back into the classroom. So I do believe that education is a great way to mitigate some of that burnout, and as well as open many doors for you. In case you decide to leave bedside, or increase and promote at the bedside. Education is certainly a great path for that, and I would highly recommend you consider that. And it is scary, but it goes by really fast. And at the University of Phoenix, we do provide great support and resources for students to finish their programs. I hope I answered your question. Built the clock for you. All right. Any other questions, Craig? Because I'll go ahead and move forward.
Yeah, there is one.
Okay.
There has been advocacy for doctoral nurse practitioner programs. Do you see this as a realistic option now? What are your thoughts, since University of Phoenix focuses on the MSN level program?
Great question. We do have a DNP program. We started the DNP program April of 2021. We're graduating in July. I'm proud to share our first cohort of students. Our doctoral nursing program is quality improvement focused. You do not have to be a nurse practitioner to go into our DNP program. And as far as the profession itself, in looking at the various terminal degrees in nursing, the DNP is extremely sought after, not only in the educational space, if you were to try to come and teach as your goal and aspiration in nursing, or as leaders in the clinical arena, or the service side of nursing, profession of nursing, whether it be community health, acute care health, any of those areas. So long story short, the DNP is highly respected. It is sought after and extremely respected, whether it be the PhD or the DNP. And in many places, especially the practice setting, NOF, which is the National Organization for Nurse Practitioners, is advising hospitals and clinics to hire only nurses with the nurse practitioner at the doctorate level. So DNP will be the key to getting a job out there as a nurse practitioner by the year 2025. That initiative is ongoing right now. And in case you're interested, I would highly recommend, if you're a nurse practitioner, or if you'd like more information about that initiative, visiting the National Organization of Nurse Practitioner website. They are the leaders in nurse practitioner education. I hope I
Great
answered your
information.
question.
Great information, Ray. And there's one more question in the chat, if you don't mind.
Sure, of course.
Okay.
Keep them coming. Keep them coming.
What do you think the salary trajectory for nurses will be? Steady or an increase to attract more nurses to the field?
That's a great question. Anytime we see a demand, right, we tend to see a rise. At least that is our hope. I can't speak to the healthcare administration aspect and the policy piece of nursing education, but I can certainly speak to the practice setting. And my experience has been that, you know, when I first became a nurse in 1996, my initial salary was $16 an hour at the bedside. So as you can see, we've grown leaps and bounds. And my understanding is that a nurse can finish one shift in 12 hours and take home $1,000 as a result of one shift nowadays, especially if it's one of those overtime types of shifts. So with that said, yes, I do see an increase in the nursing profession. With education also, there's research that suggests the higher education that you have coming into an organization, the higher the salary as well.
Thanks, Ray. Right now we're caught up with the questions, so please continue your presentation. Thank
Okay.
you.
Awesome questions. Thank you, everyone. Keep them coming. Well, it was the final slide. Questions. In summary, we talked about just a little bit of fun stuff about the past to present and the history of medicine and nursing. We talked about the core values of what frames education in nursing. And we talked about the different pathways and different degree aspects of nursing. So I'm just honored to be here, and I certainly love to answer more of your questions.
I actually have one.
Yes.
So we constantly hear about the growth of telehealth. How does that get incorporated in the future in degrees, certificates, credentials? Will they be needed or not?
That's a great question. Currently, there is a demand for telehealth qualified, nurses, and there's not a certain certificate that I know of, but certainly nursing education hears the call for action in our programs to include that aspect. And so, for example, at the University of Phoenix, our nurse practitioner program has a course embedded in the nurse practitioner program that speaks to quality healthcare and assignments that help train the student in and discovering more about telehealth and how it's used, and of course implementing telehealth, for example, in their own practice as a nurse practitioner student. I hope that answered your question, Craig.
Absolutely. Thank you.
You're welcome. We are also seeing, even at the baccalaureate level, we are seeing opportunities within the College of Nursing to integrate aspects of virtual health, telehealth into our BSN program. We're not providing a certificate. However, the student who graduates from our BSN program will at least have a framework and foundation of an understanding of what telehealth is.
Let's give it a few more minutes in case anybody's in the middle of typing, and if not, then we can
Sure.
wrap up, or you can give closing comments. While we're waiting, Ray, how did you spend your nurses week?
Great question, Craig. So on Saturday evening, the university workforce team invited me. I live in Phoenix in downtown, but they said, Dr. Brooks, would you mind coming to Southern California to speak to a group of Kaiser nurses, as well as some of our other healthcare entities during a conference engagement? And so I did. Drove from Phoenix to LA on Saturday, and it was to launch Nurses Week. It was a event called Inspired by You, and we had panelists that attended, including myself, from Kaiser, as well as the head chief nurse officer for the Department of Corrections in California, who heads all of healthcare for the prison system there. We had some great dialogue and conversation during that Inspired by You event that Saturday evening in Woodland Hills in LA. And we talked about empathy. We talked about leadership in nursing. We talked about professionalism, what a nurse would look like, act like, speak like, present themselves, how that would look like in the future and current state of nursing. So that was how I spent my launching my Nurses Week. And after that event, I drove 6 hours straight back from Phoenix, got home at 4 o'clock in the morning, just in time to celebrate Mother's Day. And that's how it was a perfect reminder. We had over, I want to say 80 attendees, and half the room were alumni of University of Phoenix doing some amazing things. And as a dean, oftentimes I'm a little bit removed from students. My job consists of a lot of policy work, resources, and helping to guide my colleagues who are the professors in revising and improving and innovating curriculum. So I don't get to interact much with students. Anytime I get to, it's just a wonderful feeling for me to be able to see the outcome of the education that we provide them with. So it was appropriate, inspiring. It was very inspiring for me, and reminds me of why we do what we do.
Actually, Ray, one of the people who are attending this webinar, Ms. Clayton, actually just put in the Q&A. Thank you, Dr. Brooks, for an excellent panel discussion on Saturday, and I enjoyed meeting you.
Oh, hi there. Oh my goodness. I'm so glad you attended. So it was so inspiring to me. The leaders on the panel were just amazing speakers. There were a couple of times where I almost cried because of the very intimate, authentic ways they were sharing their examples. So thank you for being there.
Then I have one last question.
Of course.
You mentioned DEI, diversity,
Yes.
equity, inclusion.
Yes.
Why is that so important in the field of nursing?
That's such a great question, Craig. And it's really interesting to me, as an academic and as a nurse. So I have my nurse hat and I have my academic hat. And in nursing, it's almost innate, right? Second nature. We know the population we serve. We know that we deal with diverse patients from diverse backgrounds with diverse understanding of health. So it's very innate in nursing, meaning second nature. And what we're seeing now in more recent times is now the more very forward-facing framework of DEI. The rest of the world is catching up, is what I'm trying to say here. So we've done it in nursing. We are continuing to do it, and we're doing it well, and we are improving and innovating based on the research out there. It's extremely important. The same kind of diversity, equity, and inclusion concepts that we apply to our patients, we are also applying in our programs of education to make sure that we are treating our students in the very same way that they are treating their patients with in diversity, equity, inclusion, and belonging. Great question. So extremely important. That's the short answer.
Well, that's it for the Q&A. There are no more in the queue. So I want to thank everyone for attending. I really want to thank you, Ray, for hosting this, representing the College of Nursing from University of Phoenix. You're a wonderful dean. You're very transparent, very informational discussion today. And thank you for supporting the nurses. And any last words? If you weren't going into this field, what would you have gone into?
I would just say that thank you to my amazing colleagues for all the work you do on a day-to-day basis in serving your communities. I honor you and thank you for being here. And certainly at the end of the day, no matter what degree we have, the center of nursing always has to do with service and caring and compassion. So thank you for all that you do, and happy Nurses Week. It's been an honor to be here today. So thank you.
Goodbye, everyone. We're going to get a recording of this and send it out to all of those who registered. It'll probably take a week or so, but you'll get that from me. Thank you, everyone. Thanks again, Ray. Happy
Thanks,
Nurses
Craig.
Week. Bye-bye.
Thank you. Bye-bye.